at B1 Hospitals. I'm Dr. Drsanthosh, Orthopedic surgeon. We are operating on a 62-year-old lady who has a 3-month-old ankle fracture which has not united, and also the syndesmosis is ruptured. So we will be injecting stem cells inside the fracture site in order to enhance healing, and we will be also using a tight rope to stabilize her ankle along with an anatomical plate. That's the plan for today. Thank you. This is a complication of a fracture. So in 16 weeks, a fracture of the ankle, if treated right, should have united, keeping the ankle mortis anatomical. But for her, in spite of 16 weeks, the fracture line, as you can evident, this was taken 6 days ago. The fracture line is obviously evident on the reconstruction images, and the fracture line extends straight into the syndesmosis. And as a result of that, a syndesmosis has split. The idea is to use stem cells inside her bone in order to fill up this gap you see here. Yeah? Can you see the gap there? Fill that up, and on top of it put a plate and use a tight rope in order to stabilize the dome of the ankle. You can focus on those images in order for them to get a better picture. So if you see, these are the new advanced plates. So I am planning to use, this is known as a pre-contoured plate. So here, this plate is in the shape of the ankle bone itself. So it goes and beautifully sits on the ankle bone along with the contour. And also, there are 4 fixations below. So weight bearing is easier with this. It's very nice. This is another variation of it. It's the medial hook plate. Lateral plate. Okay. I've seen. Yeah? That is the medial plate. Okay, very nice. So I probably will be using this plate so that we can have 4 fixations, 5 fixations down. Leave this for the syndesmotic rope and 3 fixations on top. That's the plan. All right. Yeah. Looks good. Now follow, sir. Please follow. Okay. And just let me also see. Put the talliko to your left. Right. Some more. Yes. Okay. Live, please.
Yes, sir.
Now this is showing the ankle of Mrs. Saraswati Girish. So if you can see, this is a 3-month-old fracture. But if you see, the fracture line is still visible. It is visible right there with very less union. And now you can see that the syndesmosis is separating completely, justifying the use of the syndesmotic screw. So when the patient is moving up and down like this, the syndesmosis separates out. The syndesmosis separates out. The syndesmosis is separating out. And when the patient is twisting her ankle like this or like this, you can see the separation. Rasha, see the separation or eversion. See? Can you see? It's completely separating out. This is what is causing her pain. Beautiful. Can you see? This is the stress test which we test clinically. This is what happens. Fantastic. Now we will be fixing this and doing the same test after the fixation. Stop. Thank you, joint after fixation. Can you see? Now there is no instability of the mortis. The ankle joint is not moving. So you see there is no instability of the mortis. Fantastic. Okay. So the PRP.
Start. Hi ma'am, how are you?
Hello. Doing well, very well.
So, your name and age solunga.
My name is Mrs. Saraswati and my age is 58.
ஓகே மேம். ஸோ நேற்று நீங்கள் வந்து ஒரு ஆங்கிள் சர்ஜரி நீங்கள் ஃபேஸ் பண்ணியிருந்தீங்க, ஒரு அட்வான்ஸ்டு ஆங்கிள் சர்ஜரி. ஸோ இப்போ நார்மலாக ஒரு சர்ஜரின்னு எடுத்துக்கிட்டிங்க பார்த்தீங்கன்னா ஒரு 1 or 2-3 days ஆகும் அட்லீஸ்ட் ரெக்கவர் ஆகிறதுக்கு. அப்புறம் அவங்க சர்ஜரி முடிச்சுட்டு நீங்கள் பெட் ரெஸ்ட் எடுக்கிறதுக்கு ஒரு நாள் டிலே ஆகும் இல்லையா? ஸோ இப்போ நீங்கள் நேற்று தான் ஒரு அட்வான்ஸ் சர்ஜரி ஃபேஸ் பண்ணீங்க. அந்த சர்ஜரி வந்து பார்த்தீங்கன்னா ஒரு அட்வான்ஸ்டு இம்ப்ளான்டேஷன், அப்புறம் வந்து உங்கள் டோன் லெகமெண்ட்ஸ் எல்லாமே வச்சு தான் நம்ம டைட் ரோப் வச்சு ஃபிக்ஸ் பண்ணியிருக்கோம். ஸோ ஏதாவது நீங்கள் அந்த சர்ஜரி ஃபேஸ் பண்ணும்போது நீங்கள் ஏதாவது ஃபீல் பண்ணீங்களா? உங்களுக்கு எப்படி இருந்தது?
ஃபர்ஸ்ட் ஆஃப் ஆல் முதல்ல ரொம்ப ஸ்கேர்டு ஆஃப் சர்ஜரி. ஸோ when they told it was general anesthesia, எனக்கு ரொம்ப சந்தோஷமாக இருந்தது that I would not be aware of anything. But because my sugar was very high, they said we can only go for spinal. எனக்கு ஸ்பைனல்னாலே ரொம்ப பயம். But Dr. Kamaraj assured me that it will be very easy. So when I went in, I had the full support of the team in the operation theatre as well as Dr. Kamaraj and Dr. Drsanthosh. So anga ponone Dr. Kamaraj made me very comfortable, and actually spinal ku romba bayindittu irundhen, but it was much easier than a normal injection. Oru second da the whole thing got over the spinal. So I was very, very comfortable. Then actually Dr. Drsanthosh had already explained that since we were using the stem cells and the latest equipment for my knee, for my ankle, he said the recovery will be very good. Enna varnalum they are going to open, they are going to put a plate na konja fear irundhudu, but when they did the surgery, absolutely because of spinal I had no vandittu only after 6 hours I got intense pain. Again I was given injection. After that absolutely no pain. Morning I have not had any injection, I'm fine. I don't have this is a dull nagging pain which is very mild, which was what I was experiencing before the implant. So adhe intensity da irukku pain, and now I'll be in a short while I'll be going home. I'll be asked to mobilize inside the room with a walker. So I'm very, very comfortable. Open pannada paatha dhan theriyudhu that it has been a major surgery, but I don't feel like that. It's like any very minor surgery madda I feel.
That's great, ma'am.
Wonderful, because the fact that I'm going home, I'll be able to walk. Today he has asked me to put 30% pressure on my feet, tomorrow 60 and day after tomorrow 90. So aduve enakku very I thought I'd be bedridden. And since my husband is a cancer patient, I was very, very worried about who will take care of both of us. So that's wonderful, because I know I can mobilize myself and I will not be dependent on another person for long. So that's a wonderful feeling that ungaloda mobility is there nu theriyadhe is a big.
So இப்போ உங்களுக்கு அந்த இரிட்டேஷன் அந்த மாதிரி ஏதாவது இருக்குங்களா?
It is only, I think, a new implant for the time being.
Okay.
But otherwise the pain is not there at all.
Pain is not there. Okay, ma'am. Fine. So I can see. Fine. Okay, ma'am. Thank you.